online.
Fátima, you can talk in Português. Você pode falar em português. But we will talk in English because the international.
Okay. No.
If you could talk.
No, it's okay.
Because you have a free translation in the YouTube, the subtitles.
Just because my
We are online.
It will be in Portuguese, okay?
Fátima, you can talk in Português. Você pode falar em português. Welcome. Welcome, everybody. It's a big pleasure to start our program about integrative oncology today. It's part of a history that we are starting strong after the cooperation between the Índia Institute of Ayurveda, the Federal University of Rio de Janeiro, and the Brazilian Acadêmico Consórcio for Integrative Health in Brazil, that is part of a big network of traditional, complementary, and integrative medicine movement. I would like to introduce the program. We have two speakers today, Dr. Sukumar and Dr. Hadar. They'll be introduced soon. And we started with the opening with Dr. Tanuja Nesari, Director of AIIA Institute of Ayurveda, that belongs to the Ministry of AYUSH in India. Mr. Suresh, Reddy, Ambassador to Brazil of India. Dr. Cristina Pinho, Mendes, Pereira, Director of National Câncer Institute, INCA, in Brazil. Dr. Paola Torres Costa, Coordinator of the Integrative Oncology Committee of CABSIN. Dr. Paula Melo Martins, Coordinator of the Ayurveda Committee of CABSIN. Dr. Fátima Ribeiro, that represents the network of traditional complementary integrative medicine that we name PICS in Brazil. Dr. José Ruguet Ribeiro Jr. from the school Yoga Brahma Vidyalaya, Assistant Coordinator of the Ayurveda Committee. Dr. Jorge Luiz Berra, Director of the Foundation Ayurveda Prema in Argentina, and also International Coordinator of the Ayurveda Committee of CABSIN. After the opening, we have the lecture of Professor Hadar from Department Kaya Shikista, from AIIA Institute of Ayurveda for 25 minutes, and then the lecture of Dr. Sukumar from the Bharataya Sanskrit Darshan Trust Integrated Cancer Treatment Research Center in Pune, India. Dr. Ruguet, you helps with the moderation and translation of the lecture. And we have some minutes at the end to debate and conclusions. So then I would like to ask Dr. Tanuja Nesari to give the preliminary talks, and thanks for your presence. Thank you very much.
Thank you. Yeah, namaskar. Good morning and good evening to everyone. At the outset, I would like to congratulate CABSIN and our partner, MOU partner, University Federal Rio de Janeiro, and Dr. Ricardo Ghelman, he's the Honorable Ambassador, Mr. Suresh Reddy ji, and who is Indian Ambassador to Brazil, Dr. Anna Cristina, General Director of National Cancer Institution, Dr. Paulo Tedras Costo, Coordinator of Integrative Oncology Committee, Dr. Martins, Coordinator of Ayurveda Committee, CABSIN, Dr. Fatima, Dr. George Ruge, our friend Dr. George Luis Bera, Dr. Sukumar Sardeshmukh, Dr. Huddar, and Dr. Raj Gopal. It's a great pleasure, honor, and it's our privilege to have this conference, and as under the MOU activity, this webinar, we can say, has been organized to understand, to discuss about contribution of Ayurveda to integrative oncology. And as Dr. Sukumar Sardeshmukh, we have, as we know that there are thousands of database of the successful stories of holistic and integrated management with the cancer for last 1 decade and more than the decade. And at All India Institute of Ayurveda, which is a tertiary care center, we also have the integrated oncology unit. Dr. Huddar is coordinating and he will be presenting the activities. And we have also MOU with the conventional medical institution, that is National Institute of Prevention of Cancer Management and National Cancer Institute under the AIMS, and under which we have academic research and the patient care collaborative activities in 4 conditions: head, neck, breast, cervical cancer. And we have developed some integrated protocol in which stage, where it is a radiology, chemoadjuvant, or primary prevention, secondary prevention, improving the survivorship, improving the quality of life, because the strength of Ayurveda is in the prevention and immunomodulation, and also in the treatment. It is a 5P medicine: prevention, promotion, and also the therapeutic management with diet, lifestyle, panchakarma, meditation, yoga, and oral medication. So earlier it was practice-based evidence, and now through the university collaboration, we are creating evidence-based practices. If you allow, I have only few slides, I'll take only 2 to 3 minutes just to share to my the Brazilian and the Argentine international guests about what Ayurveda is in how we really do in India. May I share, or shall I just speak in the audio?
You can share.
Yeah, thank you. Thank you. Yeah. Can you see the slides?
Perfectly.
Yes. So this is All India Institute. It is a tertiary care center under Ministry of AYUSH, where it is a translational research. It is a institute for creating evidence and scientific understanding of our classical wisdom. Then it is a postgraduate teaching and research institution, and also a patient care tertiary center. As we know that in India, it is the separate ministry: Ayurveda, Unani, Siddha, Homeopathy, and Naturopathy. Acronym itself is AYUSH, is the one word, and in a huge, robust infrastructure where there are more than 700,000 registered practitioners and more than 700 postgraduate institutions, drug licensing units, manufacturing units, and also hospitals. So it is a, as our Honorable Ambassador was mentioning, there is a robust system and parallel ministry where regulatory body, research bodies, national institutions, and the pharmacopoeia and the National Medicinal Plant Board, which I also have the opportunity to work as a CEO of National Medicinal Plant. And when we say that we want to promote Ayurveda as a recognized and a research evidence-based, so if we look at the Central Research Council, it is more than 34,000 research hits, we can say, research projects, where fundamental, clinical, and preclinical and drug research in Ayurveda and the AYUSH practices, products, and services are already registered, and All India Institute also is leading in creating the evidence. And as under the international cooperation of the ministry, All India Institute also has international cooperation, and we have country to country institute MOU. Our MOU is also one of the MOU, and we have the chair, AYUSH information cell, and the programs, and we also conduct various training programs online, offline. As Honorable Ambassador was mentioning, we also have the module for the bridge course for the allopathy, conventional medical doctors, paramedical professionals, dietitian, beautician, under the Ministry of Skill Development. And also, we can offer the certificate program for that. This is dedicated to the nation, All India Institute, none other by our Prime Minister, with the three visionary verticals: academic, tertiary care, and postgraduate research institution. And in OPD, it is like the conventional medical institution. It has the same huge setup where every day more than 1,500 to 2,000 patients, they visit to outpatient specialty units. We have holistic and integrated model, which is NABH accredited, and each specialty unit like diabetes, respiratory, neurology, nephrology, pediatric, geriatric, mother, child, all which are the strength of Ayurveda, which has a specialty, holistic, and supported with the modern conventional diagnostic facilities, including radiology, X-ray, biochemistry. So we have HMIS, hospital management system, so that any given condition like diabetes, we have a database of 41,000. Anorectal condition, integrated cancer management, which Dr. Huddar will chair. We also have the database of the successful stories. So this is a sort of, and it is supported with ICU and the preventive diet, lifestyle, and counseling. During COVID time, we really serve the nation and the humanity with the same integrated and holistic approach. The tagline was care with compassion, with the training to the staff for the emergency management, with the yoga to the patient, and our staff also doing it. And I'm happy to share that we did not have any mortality in mild to moderate patients. And coming to the certificate program, we have certificate program in Panchakarma, Kshara Sutra, dietitian, hospital administration, yoga, and MD, postgraduate and doctoral program, where it is university attached to Delhi University. Coming to the research project, we have 577 research project with the robust mechanism for the international publishing into the peer-reviewed journal, DRC, IRC, Institutional Ethics Committee, Data Safety Monitoring Board. So, and the publications 1,600 so far. Recently, we had the opportunity to sign a very prestigious MOU, what we are discussing under the activity as with the Rio de Janeiro and the CABSIN in front of our none other than Honorable Prime Minister. And similarly, we have signed 45 MOUs within premium national and international MOUs. And I'm really happy and proud moment for us to mention here that recently, whatever we signed with UK College of Medicine, London, UK College of Medicine and London School of Hygiene, Ashwagandha, Withania somnifera, is the first herb which has been accepted through MHRA regulatory as a medicine, not as a supplement, and it has got NHS approval as well. So this will be conducted in the long COVID as a double-blind control clinical standard. It is a gold standard. So we also look forward to this MOU partner to have many more research projects, also academic programs, and also the training programs. And lastly, recently we had an opportunity and we were blessed and fortunate to have the visit of Director General WHO Tedros Adhanom and our Ghebreyesus and Health Minister. And in its tweet, he mentioned that it is the center where tradition meets technology and which is classical yet contemporary. So with all our MOU partner, we are blessed to have the strong collaborating partner like what we are discussing now. And I'm sure we will also create another success story in the integrated and the holistic management of cancer. Thank you very much. And for this Azadi Ka Amrut Mahotsav, when India is celebrating 75th year of its independence in this year, we expect that we can create under this collaboration integrated and holistic management protocol for the cancer management through all the partners who are joined here. And I wish all the success for this program. And the speakers are eminent and experienced one. Thank you very much. Namaste.
Thank you very much, Dr. Tanuja Nesari, for your splendid introduction, and then you can see the opportunities that come from the future. I'd like just to mention that we are planning on the 12th of September, the second webinar about pediatric neurology in the field of cerebral palsy with Dr. Raja Gopala together.
Yes.
And also the interest to promote the project with long COVID with Federal University of Rio de Janeiro and Federal University of São Paulo. And now we are developing the integrative oncology.
Looking forward. Thank you.
Looking forward, yes. Where I would like to pass the talk to Dr. Suresh Reddy, Indian Ambassador to Brazil. Please, would like to hear you.
Thank you. Thank you, Dr. Ricardo. It was really a pleasure to listen to Dr. Tanuja sharing the good work which is being done by All India Institute of Ayurveda. Now, I've been here for 2 years, and it has been really impressive to hear the connect between the region. And since I'm the ambassador for India and Brazil, I'll specifically mention about Brazil and India in the field of Ayurveda. And when I first heard about CABSIN, I was even more impressed. I was really impressed to see the way this engagement, this partnership, this collaboration was happening between the Ayurveda practitioners in India and the Ayurveda practitioners in Brazil. And as I was mentioning, when our minister was here recently last week, we had a good discussion with the Brazilian authorities on how we can strengthen this partnership, how we can take it to the next level, because we have already got a good understanding at what you call at the institutional level, in the sense of between the academic institutions in Brazil and the academic institutions in India, in terms of doing some joint research. And then we also have a good connect between the practitioners on both sides, and between practitioners in Brazil, in Argentina, and also with our All India Ayurveda Institute. Now the question is, how do we take it to the next level? And that is what I'm really working on. And I hope to come back with some good news in a couple of months in terms of creating that institute. And I'm very happy to hear the subjects which Dr. Ricardo Ghelman was talking about in terms of doing this webinar. Today it is on oncology, and next month it is on pediatric neurology, and then on long COVID, the projects planning to research. It's really remarkable, because when you look at cancer is really, as we say, an outcome of lifestyle. Today it has changed. Today we have a lot of mutations, a lot of things which are happening in the gene. But fundamentally, it is also related to the lifestyle. And that is where the Ayurveda has a very critical role to play in terms of supporting your recovery process. And also, when you look at the long COVID, we are recognizing that at the end of the day, it boils down to how you your own immunity systems within the body to withstand this long COVID. And long COVID is only an indication of the challenges which are going to come in the future, because nobody was really prepared for the COVID, and nobody was prepared for the first wave, for the second wave, or whatever we want to call it. But at the end of the day, the bottom line is that everybody realized that we need to focus on ourselves. We need to strengthen the systems from inside to withstand the effect of this pandemic, the effect of this virus. And hence, I'm really very happy to hear of this research, of this collaboration which is being proposed in long COVID. And actually, from the embassy, please treat us as your partners. We are always here, happy to support, happy to work with you. And in this context, I must mention also, I was extremely happy about the translation which we were able to do of the COVID protocol, which was released by the Ministry of AYUSH. It was truly a very satisfying moment for me, because we were giving the opportunity for the people to look for some solutions to the challenge which they faced and which they did not have any other solutions. So I was really happy that we could do that translation. And with this, thank you so much, Dr. Ricardo, for inviting me, Dr. Ruge, and our friends from Argentina and from Brazil and India. Thank you so much.
Thank you very much to Suresh, Reddy. And we want very much that collaboration indeed. It will be very important to discuss. I'd like now to pass the word to Dr. Ana Cristina, Director of the National Cancer Institute. We name it INCA in Rio de Janeiro, Brazil. It's a big pleasure to receive you in our collaboration. Thank you.
Suprabhat.
This meeting is being recorded.
Okay, we know it's being recorded. Yeah, we understand that. Okay. So, Suprabhat. Bom dia a todos. Cumprimentando Sua Excelência, o Embaixador da Índia no Brasil, senhor Suresh Reddy, e o professor Sukumar Surdeshmukh, a quem eu tive o prazer, a imensa honra de receber aqui no Instituto Nacional do Câncer, no Rio de Janeiro. Eu cumprimento a todos os componentes dessa abertura. Inicialmente, eu começo, Ghelman, parabenizando o Consórcio Acadêmico Brasileiro de Saúde Integrativa, o CABSIN, pela oportunidade de podermos aprender com o professor Sukumar, esse grande nome mundial da Ayurveda, com ênfase na oncologia. Tenho certeza de que temos muito a aprender com o professor Sukumar, que, como dizemos aqui no Brasil, tem a medicina na veia, já que sua família tem se dedicado à Ayurveda há gerações. Mas, além do conhecimento desse sistema médico milenar, eles também se dedicaram ao controle do câncer ao criarem o Bharatiya Sanskrit Darshan Trust Integrated Cancer Treatment and Research Center. O centro parece ter muitas similaridades com o nosso Instituto Nacional de Câncer, atuando em diferentes áreas do controle do câncer, prevenção, diagnóstico e assistência, inclusive a usuários que moram em outras localidades. Claro que nós não temos o tratamento ayurvédico ainda. Ao escolher sermos profissionais de saúde, incluindo o professor Sukumar e sua família, tínhamos em mente fazer o melhor para os nossos pacientes, comprometendo-nos a cuidar da forma mais apropriada de quem nos confiou o seu bem mais precioso, a própria saúde. O Ayurveda vai ao encontro de nossos conceitos de um sistema de saúde ideal, sendo preventivo, preditivo, personalizado e participativo. Muitas vezes também atingimos uma grande especialização, tratando uma parte ou um setor, uma região da pessoa, sem observar as circunstâncias de sua vida. O Ayurveda, assim como outras práticas tradicionais de saúde, enfatiza o caminho da observação integral do indivíduo como uma forma de preservar a saúde, ou seja, a visão ayurvédica já recomendava uma abordagem individualizada que hoje em dia vemos ser de imensa importância na medicina. É fundamental lembrar que a Ayurveda é um sistema médico com ensinamento passado de mestre a discípulo há milhares de anos e que na Índia teve seu ensino sistematizado por meio de faculdade e pós-graduação. Com o avanço científico atual, é possível aprofundar e investigar como o Ayurveda pode colaborar e acrescentar às abordagens da medicina tradicional, inclusive na área da oncologia. Nós precisamos, especialmente nessa área, trilhar o caminho da pesquisa clínica e da pesquisa básica, tendo a ciência como forma de harmonizar diferentes visões de mundo e ampliar a nossa capacidade para controlar o câncer. Isso não só na parte de prevenção ao câncer, já que sabemos que a Ayurveda aborda a importância de uma rotina diária adequada para mantermos a saúde, mas também no suporte e na melhoria da qualidade de vida do paciente em tratamento oncológico contemporâneo. O INCA, parceiro do CABSIN no Comitê de Oncologia Integrativa, tem planejado o ingresso das práticas integrativas aos tratamentos prestados no Instituto. Por isso, eu acredito que hoje será uma enorme oportunidade para todos nós, já que o professor Sukumar tem tanto conhecimento desses dois mundos, né? O dia a dia no hospital, com assistência oncológica contemporânea e a vivência como médico de Ayurveda. Então, será uma imensa, imperdível oportunidade de aprendizado. Certamente, teremos muito, muito a aprender. E agradeço mais uma vez, já tive a oportunidade de agradecer pessoalmente, mais uma vez, professor, agradeço pela sua disponibilidade em nos ensinar. Sendo assim, reforço que somos entusiastas da oncologia integrativa e esperamos que este campo de conhecimento, assim como a própria Ayurveda, se fortaleçam no Brasil. Desejo a todos ótimo evento. Namastê.
I'm speaking English because our colleagues here, but thank you very much, Ana Cristina. If you allow, you can send the message in English to the group in India that couldn't follow us. Okay, we can do it together, please. Thank you. Now I'd like to ask for Dra. Paola Torres Costa, professor of the Federal University of Ceará, coordinator of the Oncology Committee of the CABSIN, to give your words. Please, Paola.
Good morning, everyone. I would like to express my happiness that we are all gathered here in this magnificent event. I begin by thanking everyone who organized and made this event possible. I would like to emphasize that this dialogue between clinical oncology and Ayurveda opens the frontiers of treatment for the person who experienced cancer in his or her life. Ayurveda is the science of life. And when dealing with life, we need to realize its uniqueness and diversity, crossing the boundaries of conventional science and moving towards an inclusive science. This is capable of contemplating traditional medicine through an inclusive and open dialogue for the benefit of patients. I thank my friends at the Consortium for the opportunity to coordinate the Oncology Committee, where there are so many colleagues from whom I have deep admiration, and finally to thank Dr. Sukumar and his entire team for introducing us to this meeting. I would also like to thank everyone who has promoted advances in Ayurveda in Brazil and the National Cancer Institute for always having generously and innovatively supported advances in integrative health in oncology. I consider myself a lucky person to have had the opportunity to learn and practice a little Ayurveda and to introduce this approach at Instituto Roda da Vida for needy patients, allowing my students to get in touch with this type of approach, which has a huge role in the humanization of our services in medicine. Thank you, everyone. Namaste.
Thank you, Dr. Paola, our friend. And before ask Dr. Paula Melo Martins, coordinator of the Ayurveda Committee, to talk, I'd like just to bring the importance of Dr. Huguet, to invite Dr. Sukumar to Brazil and allow us to promote the integrative oncology in this moment, because the idea would be that we develop integrative oncology with our Índia Institute of Ayurveda in the future, but Dr. Huguet bring soon that opportunity, then we have to launch everything together. Thank you. Then I'd like to pass the word to Dr. Paula Melo Martins.
Hello, good morning, everyone. Good evening. I would like to talk in Portuguese. Excuse me. É um prazer estar aqui, né, iniciando esse novo grupo, novo comitê, o novo formato do comitê de Ayurveda, né, com a minha presença e a presença do Dr. Huguet, né, como coordenador adjunto, uma grande pessoa que nos traz aqui, né, uma série de pessoas e mestres que irão compartilhar conosco essa experiência. Gostaria de cumprimentar a todos, cumprimentando também o Dr. Jorge Berra, né, grande pessoa dentro do nosso comitê, agora como um representante das nossas relações internacionais, né, e uma grande equipe de pesquisadores e profissionais que se relacionam com a Ayurveda dentro do Brasil, que são referência nesse campo, né, tendo o Comitê de Ayurveda como objetivo trazer o diálogo entre pesquisadores e profissionais, né, tanto no país como em outros países. Vejo agora esse nosso momento como uma janela de oportunidade para que possamos trilhar juntos dentro de um caminhar na formação, com as nossas instituições de pesquisa, com as nossas instituições de regulação, um diálogo mais próximo e mais eficiente para que possamos ter um Ayurveda para todos em diversas especialidades que podemos tratar de forma integrativa e complementar. Dentro da visão do Ayurveda, a abordagem do câncer está bastante voltada a uma visão holística, como já foi falado aqui, né, trazendo o respeito e o olhar para a imunidade, para a vitalidade e para todas as condições mentais e emocionais, formas estas que talvez não consigamos alcançar em nossos protocolos convencionais e ocidentais. Então, esse compartilhamento de experiências que o Dr. Sukumar vem nos prestigiar, talvez seja um grande salto para que possamos, dentro das nossas instituições, né? E aí vejo muito a participação das nossas universidades, os nossos hospitais universitários, o Instituto do Câncer aqui presente, para que possamos compartilhar técnicas, procedimentos e, principalmente, iniciarmos todos esses processos dentro da formação, uma formação acadêmica para os nossos profissionais, para que possamos, dessa forma, ter um olhar holístico, integrativo e complementar, né? Trazendo o Ayurveda para dentro dessa discussão e caminhar conjuntamente com nossa medicina tradicional. Então, é um grande prazer estar dividindo aqui com a colega, né, dentro desse evento, um comitê compartilhado pelo CABSIN entre os comitês, né, um comitê de Oncologia e Ayurveda, esse momento tão ímpar. Gostaria de colocar também a intenção do comitê de Ayurveda no sentido da discussão mais aprofundada acerca do uso das plantas medicinais, dos procedimentos e de todo um desenvolvimento em mapa de evidências para que possamos sinalizar quais as ações futuras devemos ter ao longo desse caminhar e aqui no Brasil, para que possamos construir não só no Brasil, mas como na América Latina, um Ayurveda para todos. Um bom evento a todos e muito obrigada. Namastê.
Thank you very much, Dr. Paula, from University of Brasilia, to bring your words. We will translate also in English after. I'd like to invite Dr. Fátima Ribeiro from the Brazilian Network of Traditional Complementary Integrative Medicine. We name it Reddy Brasil, to give your words. Thank you, please.
Namaste. It's a great pleasure to stay here. I am professor in the Rio de Janeiro State University, and we have a group that investigated the traditional medicine. Namaste, welcome, Dr. Sukumar, Dr. Tanuja, Dr. Vitor Hardware, Rajna Paula, and George Bernard. And our Brazilian colleagues, saudações, particularly to Dr. Huguet, the most important investigator and master in Ayurveda in Brazil. In health practices, including Chinese medicine, Ayurveda, and yoga in Brazilian health system, it's a politics. By the way, it's strongly established in primary health unit, basic unit of health system. So in hospital, it's not so common. So the participation of National Cancer Institute is very auspicious. Brazil has another particularity, have a social network, we call it PICS network, like Ricardo talk. It's a national network with the points in the states. This network helps and pressure government to improve these politics. It's formed by university, health system, professional self-employed, and other interests in the topic. We think it's a very important, this relationship. This moment is very auspicious for us. Brazilian institutes and India institutes and Argentina institutes. It's very auspicious, important, and we're so happy to participate. So we wish good work and good future for us. And this network is very happy to stay here with all us. Namaste.
Namaste. Thank you very much, Fátima. You'll be very important to spread in the network all that discussion that in the Brazil. Very important. Now I'd like to invite Dr. Jorge Berra from Prema Ayurveda Foundation in Argentina, and as Paula mentioned, work with our committee, Ayurvedic committee in the international relationship. Thank you very much to come and to bring the Argentinian group with us.
Hello, Ricardo. Thanks to everyone. Very happy to be here. First of all, I want to convey the regards from the Indian ambassador in Argentina, Dr. Sri Dinesh Bhatia, who's involved just greeting one Indian delegation with the Argentinian government. But this activity has also the sponsorship of the Indian embassy in Argentina. Also, great regards to Dr. Tanuja, to Dr. Rajagopala, to all of the Latin American brothers, much than brothers, from Brazil, and we are very happy to be here. Just to mention very few things. 1 in 8 people will have cancer during their lifetime. Cancer is a reality. It's very important. And if we think about Ayurveda, there are 5 stages where Ayurveda could be very helpful. First of all, WHO says that 50% of the cancer are related with food. Then food, it is a very broad field of activity from Ayurveda. Second, in diagnosis, some patients come to us for other topics, for other diseases, and we diagnose cancer, and we must work jointly with the oncologist. That's very, very important, because some people come to Ayurveda because they don't like modern medicine, but we are working in the integrative field, and this we must have in consideration. Third stage is the stage of after diagnosis. The patient must undergo chemotherapy, surgery, or radiotherapy, and we will help with immunity and with all the things that we, in the Ayurvedic field, we know that is to balance Vata, for example, just broadly speaking. During the chemotherapy, it's very important, and Ayurveda has a lot of resources to help to reduce side effects. And the last stage is when the oncologist says it's not need any more treatment. And we know from the Ayurvedic field that there is the possibility and the need to conduct detoxification procedures and also Rasayana therapies. And broadly speaking, Ayurveda has a lot of things to help the patients with cancer, and not only the patients, but also the families. And we know that Ayurveda has a lot of resources to help to the body, to help to the mind, to help to the spirit in these very difficult situations. Dr. Sardesh Mukh, very happy to have you here. Dr. Hudar, also Dr. Tanuja, Dr. Rajagopala, and all the brothers of CABSIN. Very happy that we from Argentina have a lot of people attend this seminar. Thanks for all.
Thank you very much, our brother Jorge Berra. I'd like to conclude the opening with the talks of Dr. Huguet, that is one of the big responsible for this meeting today. Please, Huguet, can give your words, please.
Good morning and good evening to all the dignitaries. First of all, I would like to thank the organizers and our director, Professor Tanuja. Yeah.
Sorry, Dr.
Am I audible?
No, sorry. We need just to conclude with the talk of Dr. Huguet very, very quickly.
Oh, sorry. I heard my name. That's why I started. Sorry.
No, it's just 1 minute. Sorry.
Okay. Namaste to all. Congratulations for this event. I would like to congratulate our ambassador, Indian ambassador here in Brazil, because they are doing a very big efforts to establish Ayurveda in our country in South America, help us in many activities here, and all the colleagues like Jorge Berra, Ricardo, Ana, and all of you here, and Dr. Tanuja. We have known her for many years, and I have a great admiration for her work from Pune in the Tilak University, I think.
Yes, and, I do remember.
Yeah.
Nice meeting.
For many years, around 20 years till now, in this very important work she are doing. You know, millions of people get cancer every year. Millions of people die every year from cancer. Many people don't say the word cancer for fear of declaring is something mysterious, but cancer has a lot to do about food, lifestyle, and choices. And Ayurveda has a lot to contribute. May this cooperation grow and bring about many benefits for all humanity and the planet. In our clinic experience, serving hundreds of cancer patients supporting Ayurvedic treatment, we have noticed a huge difference between patients with conventional treatments alone and with Ayurvedic treatment. Let's join forces to promote these activities, including Ayurveda and modern medicine globally. And I know Dr. Sukumar, Dr. Vital Hudar, Dr. Tanuja, they are doing a very good work in India and research about these subjects. And they have a lot to contribute with us to establish Ayurveda in these treatments here in Brazil. Dr. Carlos José doing good work in Rio de Janeiro. And now we do everything together to increase this possibility to Ayurveda contribute for one humanity more healthy and more happy. Namaste.
Thank you very much, Ruge. Now, I'd like to thank everybody to that opening that show us the perspective of development of Ayurveda in Brazil. And now we'll focus in two lectures. First, I'd like to invite Dr. Hadar, a professor associated from Department of Kaya Chikitsa, now in the Institute of Ayurveda, to give your lecture. You can share your slides if you want also. Thank you very much, Dr. Vidal.
Thank you. Thank you. Good morning and good evening. Sorry for the interruption. Previously, I heard by fault this one. So first of all, I would like to thank the organizers and our director, Madam Tanuja Nesari, Madam, for giving me this opportunity to share my few views about the integrative oncology Ayurveda AIIA perspective. So I'm just sharing slides simultaneously. Is the slide visible?
Perfect.
Yeah. So I welcome you all again. So as all the introductory remarks were talking about the integrative approach to the different conditions, particularly cancer, which we all are evidencing the integrative importance in particularly managing the cancer in a better way. In this regard, we would like to highlight how the integration can be done and what we are exactly doing at All India Institute of Ayurveda right now, and few of our experiences at this platform within 15 to 20 minutes. As all of we know, the integration is required because as all of we know that this in the 21st century, it's a deadly challenge spreading drastically in 21st century and most dangerous killer in the world according to the World Health Organization. And sure short cure still is awaited here. In such a condition, there is the option of alternative medicines for a better management, improved survival and symptom control, less anxiety and depression to the affected patients, and reduced use of chemo at the end of life, and improved family satisfaction, and the important one is the quality of life of the patients, and improved use of healthcare resources. So as we can see, the raising of this lines up to 2035 is predicted. Both the new cases and the deaths in both men and women are consistently increasing. So there is some alarming situation. At any point of view, we need to work hard on managing the cancer, either by individual medicine or either by the integration, which is best possible ways. So World Health Organization has also since long time before it is highlighting on the health services should be integrated and people-centered, and improving the patient's quality of life is also an important goal. This can be achieved by support your palliative care and psychosocial support. Many such instances are there where WHO has given. So bringing together the strength and to balance the weakness inherent in different system of healthcare. So this is important. We need to identify our strengths and the weaknesses both. Wherever possible, we have a strength. There we can integrate well, keeping the patient perspective, and cancer prevention and control in the context of an integrated approach. That is the government levels and everything here, the recommendations have been given and the emphasis has been given for the better management with integrated management. So just in a few minutes, who are very new to this Ayurvedic perspective, just we understand how we understand this cancerous conditions. Just I will not much go in detail. The names just I wanted to highlight here. So in cancer, in Ayurveda perspective, we consider the few names. It's not all the things, but just for a primary understanding. So Arbuda is a one condition where a palpable non-suppurative mass is very well explained in by the acharyas thousands of years ago. Another word is the gulma, which is a palpable masses, particularly in the abdomen and the visceral masses. And granthi is the another word, same as arbuda, but suppurating, amenable to many conditions. And vidradi and dushtavrana is another condition where the non-healing wounds, raised edges, fragility of the tissues, likewise. And the visarpa is another condition where description suggestive of malignant pathologies, where internal spreading of the cancerous conditions. Dhatugata Jwara, Pandu will not be going in much detail. These are few of the terms. What I wanted to say in this slide is, so it is many terms which have been connected with the understanding of cancer and its management. However, at last, as per the system involved and the presentation of the patient, we assess the patients based on the dosha status at different situations. So here, all the three doshas, they are called as body humors, vata, pitta, and kapha. If they are balanced, then the health of the tissues, that is the dhatus, are the tissues of the bodies which are well balanced, then the person will be healthy. If any imbalances in these doshas will lead to impairment in the metabolization of the proper tissue elements of the body, leading to the irregular or the uncontrolled growth of the tissues, leading to the cancer. So the main concept I wanted to highlight is based on the doshas. For example, during chemotherapy, the patient is presenting with some of the symptoms of the vata and pitta. And the post radiotherapy conditions also similar, vata and pitta. And after surgical removal, at the condition, if the patient comes to us, we consider little bits. Most of the times looks like this, not exactly. The vata predominance is on relapse. Again, vata predominance is to be kept. Palliative care, three doshas, and the digestive fire and other things are to be taken care at all the stages of the disease. So particularly the tissue elements affected in this condition are rasa, rakta, mamsa, and meda to say, but as per the stage, there are almost all the dhatus are involved at later stages of the disease. So coming to the strength of Ayurveda, as we are thinking about the strength, we need to identify where we can integrate with our strength. So that is mainly the preventive aspect, where diet, lifestyle, yoga advice, that is word used is dinacharya and ritucharya. Dinacharya is the daily regimen and the ritucharya is the seasonal regimen that needs to be followed. Then this is the one area where we can make the people sensitize and make the lifestyle in the long run. We can make the people to adopt these healthier lifestyle and diet, as one of our introductory speaker was telling about 50% of cancers are because of diet as per WHO. So all this takes a important role. And next is the add-on therapy. Along with the ongoing conventional therapy, we can give a supportive therapies, add-on therapies, which will enhance the recovery rate of patient. This is another area. Adjuvant therapies to counteract the side effects of a chemo and the radiotherapies, and the supportive care to improve the quality of life. And standalone, sometimes the patient, willing patients or the patient who are not fit for chemotherapy or radiotherapy, they will be opting for us, who are coming to us with these all intentions. The patients are already approaching to us. There we can go for standalone Ayurveda therapy where chemo and radio are contraindicated. So we are having different sections of the treatment. That is on the right side. That is the Shamana Chikitsa, that is treatment using the Ayurvedic medications, internal medicines, and the Shodhana, that is the Panchakarma therapy, which is called as the biopurification methods. Before giving any medications, we do, if the patient is fit for purification therapies, detoxification therapy, we administer them Shodhana Chikitsa, that is biopurification method, and followed by Rasayana Chikitsa is another interesting and very useful aspect in the management of the cancer, where immunotherapy, rejuvenation, or the Kaya Kalpas are used. That is a rejuvenation therapy, rejuvenating the cells is the another aspect. And the yoga, pranayama, and achara rasayana. Yoga, pranayama, everyone knows the contribution of that. Achara rasayana is a behavioral therapy, is also very important aspect, which ultimately leads to stress, and one of the factor for the cause for the cancer is again stress. So behavioral therapy is very well explained in Ayurveda, that also be taken. And counseling, diet, lifestyle management, and the Dinacharya, Rutucharya, which I have already explained. So apart from this the approach, the many the effects, the reported activities of Ayurveda single and compound formulations, almost we get in index journals, the activity of Ayurveda drugs already proved. In most of the times, it is a preclinical. It's unfortunate, very less clinical trials have been done. But these all are proved. The drugs are, different drugs are proved as apoptotic, cytotoxic, anti-cancerous, anti-metastatic, anti-proliferative, antioxidant, anti-mitotic, inhibit clonal expansion. Likewise, a list of all the required scientific evidences have been published in the scientific journals: tumor regression, anti-neoplastic activity, radioprotective activity, chemoprotective activity, chemopreventive activity, immunomodulation, anti-inflammatory activities. Many of these are already proved in a preclinical studies. Now a time is to integrate, mutually understand, have the evidences, safety of the drugs, and then collaborate and proceed for the clinical research projects, which will yield fruitful results in the practice of cancer. So a few activities in this regard we would like to highlight here. A Center for Integrative Oncology has been established in 2016 as a in the partnership of collaboration of NICPR, which is National Institute of Cancer Prevention and Research. It is a body of ICMR. With All India Institute of Ayurveda, it has been established in 2016, and till now it is working progressively. And under that umbrella, Integrated Cancer Care Unit has been in All India Institute of Ayurveda also running since 2017. And we have a lot of patients, more than 3,000 patients we have seen in the last 5 years. And these all type of cancers which I listed here we have come across. And the highlighted one are most commonly we are getting in our clinics, that is breast cancer, lung cancer, oral, gliomas, astrocytomas, sarcomas, gallbladder cancers, and the hepatocellular carcinomas. So these are the few cases, and we are practicing what with the aspect of previously, as I have told, in all the aspect, preventive aspects as awareness programs and regularly, and add-on therapies, adjuvant therapies, and few patients comes to us for a standalone therapies. In all aspects we are working, and we have a very challenging and interesting results. Also we are documenting all of them so that can become a lead point for the next conception of the projects. And we have also conceived few projects at the higher level of institutions. So few of the activities which Center of Integrative Oncology at AIIA has taken is Integrated Cancer Care Unit established, as I have shown previously, and patient awareness programs we are regularly conducting at World Cancer Day every year, and in between as and when required. And Jeevaniyam, a national seminar and workshop, both have been done. It was very exhaustive and very meticulously done, GVNM seminar as well as the workshop to integrative management of cancer, where all over the country, the experts have been called for, who are expertise in Ayurveda, and also allopathic people from All India Institute of Medical Sciences, Delhi, and many other places, Tata Cancer Institute from Mumbai. All the resource persons were there, and it was a very the work has been done, and now we are in a process of almost it has been developed. Now it needs to be validated. The integrative protocols based on this workshop we have developed. Gen was sample I will just going to show there. CME on integrative oncology separately has also been done, coordinated by Rashtriya Ayurveda Vidyapeeth and funded by the Ministry of AYUSH. And we are in a process of launching AYUSH Journal of Integrative Oncology. Recently, we are launching to make a better platform for the successful case stories and researches. And collaborative research projects are also going on presently with All India Institute of Ayurveda and All India Institute of Medical Sciences, Delhi, on breast cancer. And we are in a process of receiving in lung cancer also. And another, we are strengthening the network for AYUSH cancer care. So there, with the help of the Google Forms, we are collecting the strengths of different practitioners all over India, where they are able to generate the evidences, and they can come up with a particular platform, and they can be taken further for a good cause. That has been now, again, we are strengthening that in different platforms also. These are few of the activities. And this is a one sample of the integrative protocol which we have developed here based on the categorization and the stages of the conventional medicine which has been done already, what they are doing, keeping it in mind. We are where exactly the patients are coming to Ayurveda, and in what conditions, what strategy of line of treatment can be done, where our limitations are there, where to go for conventional, where to go for Ayurveda, where to go for combined therapies. All these type of for each cancer. Mainly 4 cancers we are concentrated initially, 5 to 6 strategies for different conditions in each cancer has been developed, and in future we are making it refined and making it practicable and validated. So this is another milestone in the cancer practice, that is Center of Ayurveda and Integrative Oncology, CAIO, which is just now we have yet to start. That is the center at National Cancer Institute, Jajjar, which is a part of the All India Institute of Ayurveda, All India Institute of Medical Sciences, New Delhi, where with the objective to undertake the cancer management by integrative Ayurveda principles and practices for a better patient care. Whatever we have thought, with that intention only, this center has been taken with a high ambitions with a better outcomes in terms of line of treatment, protocols, and the researches, collaborative researches. So these are the proposed activities in that is multidisciplinary care to cancer patients, integrated management of the cancer patients with a holistic approach, to provide panchakarma therapies, that is biopurification therapies for the cancer patients, to provide awareness and to sensitize the public and cancer patient, and IEC activities for general public for the awareness purpose, and integrated academic activities to sensitize, orient paramedical staff, nurses, PGs, PhDs, and faculty. This is a one key aspect which we thought there, because integration, without the integration of the faculties, understanding the difference, both sciences, what are the strength and weakness each other, without understanding, integrating the faculties first, it is not possible to integrate the line of treatment. So we are meticulously working with the oncologist and sharing our strengths and weaknesses. So on the same side with that, which will be a step way forward for us in future. So integrative research projects already has been taken, and we are expecting with the evidences at National Cancer Institute, we are going to consume more and more collaborative researches. So this is the model of integration which we thought, and it has been discussed and we have agreed. Screening of the patient will be referred. It will be going to the conventional treatment first, and then there will be given the strength and weakness, which type of patients are to be referred, and where is the strength of Ayurveda is well understood by the physician who is primary physician looking the oncologist, and he will be referring those patients to this center, and the best possible treatments we are planning in discussion with them, and the evidences later what I have told with based on the protocols and the researches will be taken in further. So the possible contributions of the integration, that is management of undesirable effects of the chemotherapy and radiotherapy, as I have highlighted earlier. Improving the quality of life is another intention. Reducing the disease symptoms, reducing the progression of the disease, that is progression-free survival, reducing the risk of relapse. So these are with these intentions it has been done, and we are also working with these few cancer conditions, most common cancer conditions, where publications, how many publications in indexed journals have been done, and how many are preclinical, how many are clinical in that, and what activity on which drug it has been taken. The work is already going almost completed for the 4 cancers, and this is another activity we are doing there, and many other conditions are there. I will not be going in detail as a short of time. These are few of the publications I would like to bring to the audience about the published works which are already evidenced in different aspects. Very interesting publications are there. Based on that we can proceed further also. And this is another that is the analysis of the marker enzymes activities clearly indicates the anti-tumor efficacy of Semicarpus anacardium. It's a nut extract on the so this is many drugs have been piperine, pipali has also been worked in lot about berberin also, and many other things are there, just with a short of time. So I would like to just AIIA perspective, how we are understanding and how the opportunities we are taking and proceeding further. Thank you. Thank you all.
Thank you very much, Dr. Hudar. If you could keep after the presentation of Dr. Sukumar, we'll be open to questions for you also. Thank you very much.
Thank you.
Then we have now our second lecture from Dr. Sukumar. I'd like to ask Ruge to help in the translation also, as you did some times ago. I'd like just to before yes.
Namaste everyone. Bonjour. It's a pleasure and honor to be in front of all the stalwarts. Firstly, I'm honored to be with Dr. Tanuja ma'am, the director of All India Institute of Ayurveda. Also, I'm thankful to all the stalwarts who have joined, to Dr. And also thankful to the Ambassador of India to Brazil, Mr. Reddy, and all the stalwarts here. Thank you, Dr. Ruge sir, as well, who has been a strong supporter of promoting Ayurveda in different parts of the world, especially in Brazil, in integrative oncology.
Can I share?
Yeah. So before starting, I would like to first tell you that we have an institute in Pune, which is called as Integrative Cancer Center Institute in Pune. We are happy and proud that we are the institute in India under the Center of Excellence of AYUSH Ministry. And we are also been working from last 9 years with the Tata Cancer Institute or the Tata Trust, which is one of the leading chain of cancer hospitals in India. And I would like to share some things before that, going before to this slide, that we were happy and we were proud that some years before, the AYUSH Ministry had recommended our name to the National Geographic Channel, who had come to India to talk or to work more on the AYUSH or on the cancer perspective. And we were happy that the National Geographic Channel, a very well-known media group, could cover us, and they would show our center in this documentary, which was given by the for the cancer, integrative cancer. So I would request Dr. Ruge to please play the
material much faster than any other science.
At the Integrated Cancer Treatment and Research Center in Pune, this thousands of years old medicinal practice is integrated with modern day scientific practice to heal hundreds of cancer patients. In India, almost 556,400 people die annually due to this deadly disease, with 700,000 new cases reported each year. Here, the patients are first administered radiation therapy, which kills cancer cells, but triggers adverse side effects, thus bringing down the overall vitality of the body. To counter this, a series of Ayurvedic therapies are given, which restore the vitality and necessary balance in the body.
The allopathic treatment might just come to an end, but the Ayurvedic treatment clubbed together will continue for a very long time, so that the short-term and the long-term side effects can be mitigated, as well as the patient can be given a good quality of life.
Almost a decade ago, the life of a botanical scientist from Mumbai got entangled in a rare kind of cancer. Rijuta Kulshalkar, a happily married woman in her late 30s, was diagnosed with cortical thymoma, a rare cancerous tumor located near the heart. Owing to her young age, doctors reluctantly agreed to administer chemo and radiation therapy, which further aggravated her agony.
Half of my left lung was collapsed because of radiation.
Distressed mentally and physically, hopelessness engulfed Rijuta as she began to wind up her life with a maximum time frame of 6 more months to live.
Suddenly our happy family came to an end. Yamraj was sitting next to me, and I could see my small son growing up without a mother.
This was like I had no ground under my feet.
Unwilling to let her go without trying the last available option, her husband brought her to this institute, wherein she was introduced to Ayurveda. Doctors here treated Rijuta with an ancient method of Rasayana Chikitsa and 9 cycles of Panchkarma.
Rasayana Chikitsa is a very important treatment in Ayurveda. So we treated her with that treatment and Panchakarma treatment for 9 times. Speciality of Panchakarma treatment is that it is a detoxifying treatment. So it removes toxins from your body, and after taking Panchakarma, your cells start growing normally.
Rijuta survived. It's been more than 10 years now.
10 years and 8 months from the diagnosis of cancer as today, I think she should consider herself cured of cancer, but suffering from the side reactions of earlier radiation treatment and chemotherapy.
My cardiologist says with so much of radiation and chemo, your heart is really in very good condition.
We are trying to live every moment of our life because it's a gift. This would not have been there but for Ayurveda.
It is believed that diseases came with the origin of human existence on the planet. Since then, human beings have been researching on their own bodies and devising various methodologies to restore it to normalcy. More importantly, to eliminate not only diseases, but the root cause of them. In the ancient civilizations of Mesopotamia, Egypt, Greece, China, and the Indus Valley, traditional medicine combined philosophy, belief, and knowledge to treat the human body. While these systems are ancient, their relevance continues. Nearly 70% of the Indian population still depends on traditional medicine for primary health care. In Africa, this number stands at 80%. In the European Union alone, it is believed that 100 million people use traditional or herbal medicines. In China, it is estimated that 50% of the medicines are of herbal origin. Across the globe, the acceptance of traditional modes of treatment has seen a momentous surge.
You can stop, please.
Yes. So we saw a video where it was an documentary made by the National Geographic Channel, which says that yes, the integrative research with Ayurveda and modern medicine together, we can definitely help. We definitely help on main 3 to 4 levels, as Dr. Tanuja Nesari madam also said earlier. One is to reduce the side effects of chemotherapy and radiations. Till now, what has happened is we have not been able to produce more evidences and research work on clinical trials that can help us to prove that yes, by Ayurvedic medicines and Ayurvedic treatment, we can reduce the side effects of chemotherapy and radiations. At the same time, we can also help to improve the immunomodulatory action, that is to improve the immune system by Rasayana Chikitsa. And also Ayurveda plays a very important role in the palliative care. I think that is one of the things that Ayurveda helps a lot, and to improve the quality of life. So I think let us proceed with the presentation. I'm not going to go into the big detail, but I'm just going to tell you that what Ayurveda can help in treating cancer with an integrative approach. So as we know in modern science, it leads cancer is said to be an abnormal growth of body cells, but in Ayurveda it is not mentioned directly in any Ayurvedic text. So we compared, as Dr. Habdar also said, we compared, or we have the similar type of conditions and diseases that we can compare it to, like Arbuda, Vidradi, so like tumors or any type of abscess or any type of viscer or cellulitis. So there are different things that we can correlate it with according to the Ayurvedic text. So basically, it is also a concept of Mahagata. Mahagata means it is a concept which has been told in Ayurveda that cannot be treatable. So it is a compilation of all diseases that come, or the symptoms that cannot be treatable. So it contains under that. So we have to find the causative factors. We have to find because it contains a cluster of diseases and symptoms. And also there are multiple factors which are involved in the pathogenesis. So when we treat cancer, there are multiple factors which are involved in the pathogenesis of cancer. So basically, what is Mahagata, that has been also told in Ayurveda. So we can say it as Vatavedi because Vata dosha is predominant. As also like ascites, we can correlate it to Udara. Then Gulma, it can be considered as consolidated dosha dhatu. So why this is a concept of Mahagata in Ayurveda? Because the criteria is, it is difficult to understand, it is difficult to treat, it is leading to death, or untreatable or widespread. According to Ayurveda, this type of disease or cancer disease is usually Kashta Sadhya or Krutsha Sadhya or Asadhya. That means they are untreatable or very hard, or they are very chronic to treat the patients. So basically, we should understand if it is local growth, if it is if the tumor which is there or the cancer which is there, if it is on the local growth or it is spreading all over the body. So that means it can be metastasis. So it can be from one part or one organ to another, different organs can spread. So it can be metastasis, and Ayurveda sees it also under that point of view. So basically, I'll give you some examples. We also consider the concept of Roga Marga. Roga Marga means it is either intra-alimentary or extra-alimentary. What is the involvement of the cancer which is there in the body? For example, if we take an example of cancer of stomach, according to Ayurveda, the diagnostic is Amashay Dhatu Mausa Arbuda, and also the extra elementary involvement can be muscle tissue, but the intra-elementary involvement is the stomach. So like that, we also can have the concept of Roga Marga, or the internal paths or the canals which are in the body, and we can, according to that, we can treat the patient. So as we said, there are different approaches. Basically, we have got good evidence-based and clinical work done in especially Hodgkin diseases and also non-Hodgkin lymphomas. So this type of patients, we correlated with different conditions in Ayurveda as Rasa Rakta Dhatu Jwara, that is fever pertaining to Rasa and Rakta Dhatu, or Rakta Pitta, that is another disorder, another disease which we can correlate it to bleeding disorders. So as Dr. Haddar also said, that we correlate, or we have the similarity of the diseases or the conditions, we correlate it with different things like edema. In the malignant edema, we can correlate to Shotha. Malignant wounds and ulcer, we can correlate to Dushtavrana. Malignant nodes, so usually we can see in axillary nodes, or usually in CA breast, there is a metastasis in axillary nodes. So it can be correlated to Dushta Granthi, and malignant tumors can be correlated to Arbuto. So likewise, there are different correlations that we can first finalize in Ayurveda and then do the treatment part of it. Then, as we say, what are the approaches? First, we have to find the doshas which are imbalanced, then the dhatu dushti, which tissue is imbalanced, then which mala is imbalanced. The most important factor that we always consider in the patient is the digestive fire or the digestion of the patient, which is called as Agni. And the most important thing also, the bala of the patient. Bala means if the patient is physically liable or okay to take the Panchakarma Shodhan processes which have been told in Ayurveda, or if the Agni and if Bala is not proper, then palliative care should be suggested. Also, the most important thing is the which Ayurveda suggested is the Dhatupak Avastha. Dhatupak Avastha is one condition in Ayurveda which we can say that after the too much of vitiation of the tissues, and when it goes more deeper, then it goes to the Dhatupak Avastha. Dhatupak Avastha means there is a loss of the tissues, where the destruction of the tissues take place. So for example, in some cases like CA tongue or CA buccal mucosa or CA cheeks, you can see that there is a destruction of the tissues which happens, and you can see a lot of wounds and oozing of the pus formation or the blood coming there. So this is a typical, we can give an example of the Dhatupak Avastha, and according to that, we have to give the treatment. And also Stroto Dushti, which strotas or which channels of the body are responsible. For example, if there is CA lungs, according to Ayurveda, we take it under Pranava Strotasa, which we can correlate it to the upper respiratory tract. Or for example, CA stomach, we can say it as Annava Strotasa, which we can relate it to the GI tract or digestive system of the body. So there are different approaches. I don't want to go in the theoretical part. I just want to show you some things that are very important. The most important thing is that we are able to help the patients to reduce the side effects of chemotherapy and radiations. So I think symptomatic treatment with different herbs and formulations, and it is very essential that in Ayurveda we have got various not only herbs but also herbo-mineral and herbo-metallic formulations that are proven and which are safe, standardized, and effectively used. Our institute has been tied up with Tatas, as I said before. We are doing the all the test or the standardization with the Tata Trust, the Attract Institute, which is in Mumbai, and we do all the animal study and the toxicological studies which are needed for the herbo-mineral or the herbo-metallic formulations which you use in different types of cancer. Again, the most important point that Ayurveda has considered always in cancer is the mind. So because we see that a lot of people who are having mental stress or different imbalances of the mind can be a main problem or the main cause of cancer. And also the main important thing that Ayurveda should consider, and Ayurveda considers is and helps also to improve, is the Vedic Shamatva, that is the immunity. The people who usually have low immunity can have the problem or the complication that they suffer more, and the spread of the disease can be more easily, like the metastasis in different parts of the body. So basically, what are the causative factors? So usually people ask us, according to Ayurveda, what are the causative factors? As we say, diet, which we had told earlier, 50% of the people suffer to improper diet. But we can say improper lifestyle changes, improper diet. So what type of diet usually you take? The diet which is too much spicy, the diet which is too much hot in properties, that it affects the Agni, that is digestive system in Ayurveda, and it tries to imbalance the different dhatus from the lymphatic, that is the Drasa dhatu, to the Rakta dhatu, that is the blood tissue, to all the tissues, and the main part is the ojas of the body. It tries to, these all types of food which we eat, which are of hot properties or of heavy properties, they try to affect our digestive system and affect the ojas of the body, because they're opposite to all these properties. So we can see also contradictory food is also one of the things which we have given. So there are different hetus. One of the main causative factor, we can say that it's upholding of natural urges. There are many people who have the problem of holding the natural urges or day sleep. That has also been told in Ayurveda. Also the causative factors, the main thing which I talked about, the mental stress. So there are different things that we talk about, that is anger, anxiety, fear, greed. So there are things that are responsible as causative factors. Now, the main importance is the addiction. So we should also consider that according to Ayurveda, we have also taken vyasana or addiction as one of the main causative factors. So these are the different things we can see. A lot of people usually in India, in the rural parts of India, have the problem of eating a lot of tobacco on other betel leaf. So they have usually got more problems of oral cancers. So this is, we can find the different causative factors, and which also affects the oja. So basically, past illness, we should not avoid any past illness. If there is any past illness, we should cure it. That's what Ayurveda says. As Dr. Tanuja and Nesari madam said correctly, that Ayurveda believes in more prevention than cure. So if you prevent it at the earlier parts, if you have any problems, so we can give an example that usually in CA esophagus or CA stomach or CA small intestines, we can see the past illnesses of recurrent or frequent indigestion or ajirna or hyperacidity problems. So also hereditary is one of the point that we usually see. We have seen many cases, usually in patients of CA breast, that the mother is having cancer, but also the daughter can usually gets cancer. So this is an example of the hereditary cancer. So what we do is, usually if the mother has cancer and if she has a daughter, we also do an prevention program for different panchakarma or detoxification processes which have been given, rasayana chikitsa as well as the palliative care. So how the pathogenesis in Ayurveda works, how it works. So all mainly talks about the imbalances affecting the digestive system, because according to Ayurveda, rogai sarvapi mandagnu, anything that happens in the body, any disease or any condition is due to the digestive problem, and then it starts affecting the tissues. When it goes more into deeper into the tissues, it starts having the abnormal growth or the destruction of tissues, and this is how we go towards the cancerous things. So what are the treatment part? So let me tell you that there are different treatment parts. Ayurveda not only believes in giving medicines, but also believes in spiritual treatment. So like the Deva Upashna Chikitsa or spirituality, or also having chanting of mantras. We have done a research in our institute that if you do specific mantras or specific pujas for some type of for specific type of cancer, it definitely helps for their mental health. So this is done. The main important is the counseling, which we also do. The most important thing, according to the Agni, that is the digestive system, and the Bala of the patient, that is the strength of the patient, the Panchakarma should be suggested. And Panchakarma really helps in detoxifying all the toxins which are there in the cancer patients. So I'll not talk about it. I'll give you an example what usually we do. Panchakarma. Panchakarma is the 5 detoxification processes. So what we carry out is, for example, in some cancer types like CA throat, lung, breast, or melanoma of skin or Hodgkin disease, we do Vamana. Vamana is basically done for when there is too much of fixation of kapha dosha. In duodenum, pancreas, and CA liver, we do the Virechana. In CA rectum, cervix, uterus, ovaries, testes, bone metastasis, we do the Basti. In CA nasopharynx and CA brain, we do the Nasya. And liver and leukemia, we do the Rakta Mokshana. So these are the 5 Panchakarmas which you can see. And there are the type of cancers which usually in that patients, we do this type of treatment. So these are the just examples to you what herbs or what single herbs or herbal mixtures do we use, in which pharmaceutical forms we use. The main is that we are also having a very good benefit from the medicated Gruta or the ghee, which has been done, and we have done an extensive research. And I am happy to tell you that recently we did 15 formulations with different pharmaceutical forms in Ayurveda with Tata Trust, and we have got patents for 15 of them. I am happy and glad to tell that we have got the Indian patent for all the 15, and now we are filed for the US patents. And we have also got the first chemo recovery kit from Ayurveda by this, which supports and helps to reduce the side effects of chemotherapy, like loss of hair or vomiting, diarrhea, or ulcers, or loss in weight and loss in hunger. So all these things, if you the herbs or the formulations which we have used, and we have made a pilot study of more than 1,500 cases of different types of cancer who are taking chemotherapy. And if you use these herbs, which we have done for the chemo recovery kit, we have got a very good result for that. So these are the different types of cancer, and we use this type of formulations which are there. Then Rasayana Chikitsa, rejuvenation. Let me tell you that there is always a controversy about using metals in Ayurveda, but the metallic formulations or herbometallic formulations which we use, or the single metallic formulations like Suvarna Bhasma, that is the nanoparticle of the ash made from the gold or silver, they have been extensively used in different types of cancer with a good efficacy and standardized protocols. And you will not believe that we have seen extensively good results in CA brain, leukemia, or Hodgkin's diseases, or different types of cancer using the metallic formulations as well. So what is the diet? That is also been told in Ayurveda. What should be contraindicated? That has been also been told in Ayurveda. What should be the beneficial pattern of your life, the daily regime, what you should follow, what you should not follow. So I'll give you a case report. I just want to talk about two cases now. So for example, this case is from Germany. He's a patient of malignant melanoma post-surgery. When he was diagnosed with malignant melanoma, he came to us. That time the age was diagnosis was 48. His current age is 64. So Ayurvedic diagnosis we had done here, that has been written. Ayurvedic treatment we started. The history was excision of the tumor, which was done in 1998, 1999. When you come, or if you want, we can give you the detailed reports of these patients as well. So we have more than 16,000 patients data already ready with us. So Ayurvedic treatment was started in September 1998. Duration of the Ayurvedic treatment till now is 16 years, 3 months. The 10 years rate of survival is 10%. Let me tell you what are the medicines which are given to him. We also gave extensively Panchakarma to him. He took Panchakarma in this consecutive years of this specific type of Panchakarma which was given to the patient. And you will see what was the gradation before the treatment and gradation after the treatment. So frequent skin rashes, frequent cold, Karnofsky score, which is one of the main thing which can be seen, ECOG, functional score, global score, symptomatic scores. So all of this, we have a data and we have the reports done, and we have a good results after gradation after the treatment. The remark by the oncologist is very important for us because we know what Ayurveda has done. So oncologist said that complete remission seen after 16 years, 3 months of Ayurvedic treatment. Patient refused to take chemotherapy, but no recurrence is seen. Even he refused. MRI USG done on annual basis are within normal limits. And current follow-up was done in from 2014. He has been doing current follow-up with oncologists in Germany, and they said that all the reports are within normal levels. There's another case which I just want to share very fast because of the time limit. This is a case of a female of age of diagnosis was 48. We cannot reveal the names. The current age is 56. It's a high-grade metastatic adenocarcinoma with liver mets. The history was chemotherapy, 6 cycles were given, 4 before starting Ayurvedic treatments and 2 after. According to Ayurveda, we did our diagnosis. Ayurvedic treatment started from 2006. Duration of the Ayurvedic treatment was 8 years, 11 months. Rate of survival, we knew it is 38%. These were the medicines which usually we gave. These were the reports, which were findings of the reports of different years when they did it. Then 2011, when you see only on Ayurvedic treatment and TAB endocrine stop, there was no finding. There was no abnormal findings. And also in USG, which was done recently in 2012, there was also no abnormal findings. So that means the patient, we cannot say we cured it, but we can say that yes, we have improved their quality of life. There is some or the other part where the disease have stopped to spread in the body and they are living a normal life. So these were the case reports that was given. These were the scores. The most important thing that people ask the Ayurvedic doctors that what research work and what evidence work have you done? So let me tell you that we are very proud that we have done enormous research work and evidence work. We have many international publications which have been published in very well-known international journals. So one of them I can give you an example that also the drug standardization, because as we said that the report in JAMA that says that Ayurvedic medicines can cause toxic effects, but here we can prove that in a marine drugs journal in Switzerland, we had they had published our international paper on pharmaceutical standardization and physiochemical characterization of traditional Ayurvedic marine drug. So this was been published recently. One of the other preclinical research which we had done, which was very important, as we had seen with Dr. Huddar also said about the oral cancer. So we had given a formulation for gargling for the oral cancer, and we got very good results. And then we published an international paper which was published in the Journal of Herbal Medicine. So antimicrobial and antioxidant potential of a standardized Ayurvedic formulation explains its clinical efficacy as gargles in post-radiotherapy oral cancer. So this is what was we had published. And the most important thing we got published was the effectiveness of combinations of Ayurvedic drugs in elevating drug toxicity and improving quality of life of patients treated with chemotherapy. So to reduce the side effects of chemotherapy, we had done extensively work on more than a pilot study of 1,500 different types of cancers who are taking chemotherapy, giving Ayurvedic treatment side by side. And we have got a very good result in that. And that's why this international paper was been submitted and accepted. So this is what we need to prove now. We need to go hand in hand with the modern medicine as an integrative approach. And thank you for that. This is what usually the work we have done. And I'm thankful again to the AYUSH Ministry, especially Mr. Dr. Manoj Nesri sir, Dr. Tanuja Nesri madam, and especially Vaidya Rajesh Kotecha sir, always for being a support to the institute and also to us. I think this was a short glimpse of what work we have been doing. And I'm very happy that recently our chemo recovery drugs was been approved by the FDA, and it was been launched by the Governor of Maharashtra. And he visited our institute and he saw that we showed him many cancer patients in front of him with all the reports. And he was really very amazed, and he was happy to see that how Ayurveda can help in different types of cancer. And I'm again thankful to everyone. I just give one small invitation that we are having an international cancer conference on 9th, 10th, and 11th of December in Pune, where we are getting all the international stalwarts on integrative medicine who are working on oncology, integrative oncology. And you will be happy that we have already got confirmations from all the stalwarts, and also mainly the Tata Hospital will be one of the main participation in this cancer conference. So thank you everyone for your patient listening. Thank you very much. Namaste.
Thank you very much, Dr. Sukumar. Perhaps Roger would like to give some comments, or can we open?
Sim. Eu vou fazer rápido comentário em português, como resumo daquilo que o Dr. Sukumar disse durante a sua apresentação. Bom, ele tem hospital que já atendeu mais de 6.000 pessoas no tratamento do câncer de forma integrativa. Então, isso tem peso assim, de estatística, de resultados bastante importante. O que fica muito claro é que não dá para poder tratar ou prevenir com a Ayurveda sem conhecer a fisiologia, a fisiopatologia do Ayurveda. A linguagem não é a mesma. Senão nós caímos naquele conceito. Qual erva é boa para tratar qual câncer? E aí essa não é. E aí o Ayurveda perde muita capacidade de ajudar, de contribuir. Vocês veem que nós tivemos essa experiência no Covid. Para poder entender como o Ayurveda pode contribuir no tratamento do Covid, nós tivemos que entender, do ponto de vista do Ayurveda, a fisiopatologia do Covid. Ou seja, porque o Ayurveda é sindrômico. O Ayurveda analisa a doença pelos sinais e sintomas. Então, por exemplo, a primeira fase traduzia-se como uma fase Kapha, isso no Covid. Depois uma fase Pitta, depois uma fase Vata. Ou seja, nós interpretamos sempre do ponto de vista de Dosha, Dhatu, Agni, Mala, mente, sentidos e alma. Esse é o conceito. Então, o Dr. Sukumar, no início, ele trouxe a tradução fisiopatológica dos problemas do câncer do ponto de vista ayurvédico. Para que, a partir daí, nós sabemos como abordar aquela pessoa com o tratamento. Vocês veem que tudo começa no sistema digestivo. Essa relação entre indigestão e uma doença grave posterior é única no Ayurveda. E hoje isso está sendo também abordado. Então, o foco na visão ayurvédica foi o que ele trouxe de mais importante, e é o que nós, quando formos fazer trabalhos científicos, nós devemos aprender essa linguagem também e abordar sob esse ponto de vista, para depois, então, demonstrar os resultados, como ele fez aqui. Então, era esse rápido comentário que eu gostaria de fazer. Dos medicamentos que ele propõe, muitas das ervas nós temos no Brasil, porque elas são já naturais aqui, como na Índia. Nós temos aqui na América do Sul, na Argentina também, muitas dessas ervas. Parte desse estudo foi demonstrado naquele protocolo do Covid, mas há muito mais sobre isso. E apenas os remédios com metais é que há, de fato, uma restrição bastante grande fora da Índia, enquanto a Índia não provar que esses remédios são não tóxicos. Porque o argumento é o modo com que o Ayurveda prepara os medicamentos tira a toxicidade deles, dos metais pesados, e torna-os importantes ferramentas de tratamento. Mas aí depende agora do Ministério AIUSH, com os centros de pesquisa, provarem essa não toxicidade, essa segurança dos medicamentos. Então, há um campo imenso a se fazer e há estudos, mas sempre do ponto de vista de comparação e de trazer, porque nem sempre a doença vista do ponto de vista da medicina moderna é igual à doença do ponto de vista ocidental. Por exemplo, diabetes, existem 20 tipos diferentes no Ayurveda. Então, não é simplesmente trazer o tratamento com o mesmo nome da doença, não é? Então, há um trabalho a se fazer nesse campo. Muito obrigado.
Dr. Sukumar would like to mention something about the National Cancer Institute.
Thank you very much. I think that it was a pleasure and honor to visit INCA. I'm really thankful to Dr. Anna and Dr. Carlos for inviting me. I think they are doing a superb work in cancer. They are really having a very well-defined and protocol work in cancer, which I saw that day. There are various patients in different departments of cancer, from hematology to pediatric cancer. I myself could see the patients, and the immense evidence work they are also doing is really commendable. I think if we go hand in hand with the alternative medicine together, I think integrative approach will really will give a very good results, especially for these patients who are there in this hospital. I really thank for inviting me in this very nice institute which you are running. Thanks a lot.
Carlos, would you like to talk something?
Yeah, thank you very much, Dr. Sukumar. And we really think that we could design some protocols to develop research and put together the Ayurvedic treatment with the traditional treatment with chemotherapy. And we think that for improve the quality of life, but also to reduce the toxicity, we have many opportunities to investigate. So we are open to do this research together.
Dr. Raja Gopala would like to say something.
Thank you. Nothing more to add. We have a great start, and this was a wonderful event. We had experience sharing from two reputed institutions. I know Senior Sardesh Muksar and his work in cancer. And of course, I have not met Dr. Shikma. It was a wonderful event. And I think on 12th of September also, we are going to have one more on cerebral palsy, the experience of All India Institute of Ayurveda, where we have good outcome. We are preparing for that. Hope to meet you all there. Thank you, Dr. Ricardo. Thank you very much.
Yes, just to mention that parenthesis about the cerebral palsy, we are organizing invitation from several institutions in Brazil to be part. But I would like to open the questions from the audience and to debate about the two presentations. Then we can go deeper to the questions.
Ricardo.
Yes, please.
I would like to reinforce Dr. Huguet talk and emphasize the importance of training in this type of rationality. The Dr. Huguet has contributed a lot of this, and we need to reinforce the INCA support to continue our advances in Ayurvedic in Brazil. I'd like to say to Dr. Huguet, thank you very much for your commitment with our cause and all of us, and to say to Dr. Sukumar, thank you very much for your very deep and clear talk. It's so important for all of us, in my opinion. And maybe this is the first step in in very important advance for us in Brazil. Thank you very much for Dr. Sukumar. Namaste.
Thank you, sir. Thank you, ma'am. Namaste. Looking forward to see you in December in Pune.
I think it's important that you have a audiência. Are you asking in Portuguese now? Gostaríamos de abrir para perguntas. Eu não sei se Caio pode nos apoiar. Quem está de receber as perguntas.
Sim, Ricardo. Não temos perguntas, só elogios e agradecimentos. E tem uma pergunta da professora Ana aqui no chat, em inglês.
Okay, então, just thanks and until now. Eu vou procurar, eu look for in the chat. Doutora Ana Rodrigues. You can talk, Doutora Ana Rodrigues, directly.
Oh, thank you. Namaskar, Dr. Sukumar. Namaskar, Dr. Vital, Ruge, everyone here. So I just have a question. Thank you very much for your explanation. And I'm a doctor here in Brazil also with Ayurveda also since 1998. So it's a great pleasure to hear you both and everyone here. And I missed your workshop, Dr. Sukumar, on Saturday, but I was in another project. So I hope to receive the recording of your talk. So I just have one question, and I wrote in the chat. Well, how are you thinking? And you, Dr. Vital, you can both say something about it. Having understanding a little bit from the Ayurveda status in Brazil right now, on how we can work together with cancer patients, as we do not have so many doctors, not quantity of herbs actually available here working with Ayurveda. So I'm glad I hear Dr. Carlos from Inca saying that they are open, right, to really study and implement the protocols. But I just want to hear your thinking as much as you had already saw from the Inca and being there with Ruge and in our work. So I mostly work with Panchakarma also. So thank you once again, and just want to hear your thoughts.
I think this is a question that more Professor Dr. Tanuja Nesari ma'am can address, because she's the one who is striving hard to collaborate Ayurveda in different countries with research and evidence. I think she is the right person to give the answer.
Yeah, the question is how do we have the collaboration with the centers, right, Dr. Sukumar and Professor?
Yes, actually,
Anna.
Yeah.
Namaste.
Namaste. It's just about, because we don't have so many doctors here. So, and with the Inca Institute really receiving and welcoming the possibility, will be very wonderful, really. But as we do not have so many doctors and no so many quantity of herbs, Ayurvedic herbs here, so 60. I don't know if you get some thinking about it, but I just want to hear your thoughts. Thank you.
Yeah, basically the question, your question is very, very relevant, because it is the one which everyone has the same in mind, because once we start propagating the principal theory and practices of Ayurveda, the approach, then everyone wants, the first question is, where is the medicine? If I really want to have, then how do we get the medicine? So there are many medicines which are available from India, not as a medicine, but the same plant in the name of the supplements, herbal supplements, food supplements, it is available. But more importantly, what is more important to have the approach, understanding of Ayurveda, and maybe we develop the practices and the applications which are true to the local native, the local. So your local food, local herbs, and the local medicine, how do we understand the Ayurveda principles into that? And then that could be more user friendly. That's very important, and that's the way how it is to be promoted. But how to understand, how to know the Ayurvedic principles in the Brazilian food, in the Argentina food, and in Argentina and in Brazilian herbs. For that, we need to have more understanding. And for that, we are there. And many Ayurveda institutions in India, we can, like we meet online, sometimes offline, sometimes you can come, sometimes we can come, or we can also discuss online. Then that is the true crux, the final goal. Maybe if the building is 10 steps, then the final aim is to develop the Ayurveda customized to the Brazilian, develop the Ayurveda customized to the Argentina and the entire part of the world. That's the ultimate goal. That is how it purpose the humanity. But the beginning is the spices, kitchen herbs, which can be like cinnamon, black pepper, whatever we use. The spices are available everywhere. Some common herbs are available in India, in Ayurveda practice, and in Amazon, in Brazil, in Argentina. We can identify those and can be used. That is very easiest way. And the third immediate quick fix, we can say, we can have the export of what we are using and which is really evidence-based, practice-based, that can be made available readily and which is common, that is the most easiest step. But before that, even there are regulations, then you can start using the food, nutraceutical, spices, kitchen pharmacy for the treatment of the small ailment, prevention, diet, lifestyle, value, like whatever is the conventional treatment, you can add on the support. And also there are many pharmaceutical manufacturers, they have the products available in Brazil and in Argentina. And All India Institute of Ayurveda and many others, we can have collaborative programs where we can have more and more orientation, starting from the superficial to deep understanding about the principles and application. Thank you.
Yeah, thank you very much. It is important for all of us to hear your point. Thank you so much, Dr. Tanuja.
Thank you. Welcome.
I'd like just to add that we sent to Dr. Tanuja a list of about 60 medicinal plants in Brazil that grow, that have
great
direct correlation with the Ayurvedic. Dr. Amanda Ruguet, Dr. Ruguet sent to us, and we have a big opportunity here. It's not so few plants, it's about 60.
Oh, and great. That's really great. I think it is a treatment of almost all.
And I'd like to I have a question, Dr. Sukumar, about the indigestion.
Indigestion.
But you mentioned the mental perspective.
Right.
I'd like to know the connection between the gut and the brain and the mental health and the digestion. If you have the concept of mental indigestion in Ayurveda.
Right. So actually Ayurveda is a science which believes not only in physical health, but also mental health and spiritual health. So basically mental imbalance, or when we say there is an imbalance of the mind due to any reasons, it can be stress, grief, fear, whatever the reasons are. According to that, the problem, it triggers the mental imbalance, and which immediately affects the digestive system. So always we give a very good example. in India, that if you are in a if you're fighting over a lunch or a dinner, it cannot be digested properly, because there is a connection, there is a direct relation between the mind and the body. So immediately, if the mental imbalance is there, it indirectly or directly affects the digestive system or the body, as well as the secretions in the body. So I think this is what the correlation between the mental health and body can be done.
Thank you very much. We have a question.
Just one thing to put. We were talking about the herbs which are available in Brazil. I totally agree with Dr. Tanuja ma'am that whatever is available here, first we research that and we can use it in different diseases. I think Dr. Ruge has been doing extensive work in this. I have been seeing his institute from last many days, and he has already done a lot of work in that. He's not only talking about it, he himself has planted so many herbs here, and he has been using it in different medicines himself. So I think that is possible in Brazil.
Thank you. So I saw now the hands open, Dr. Fátima, Dr. Jorge Berra, and Dr. Paula. I would like just to add that we received from the YouTube a question specifically about the training for the nurses, to nurse. If you have training of nursing in Ayurvedic oncology, and after we can have the question from Dr. Fátima, the nurse, please.
So regarding the training of nurses, also I think first let the expert Dr. Tanuja Nesari ma'am tell, and then I will tell mine.
The skill development program, we have the AYUSH nursing program. For the skill is 3 types. One is a new skill, another is upskilling, and recognition of prior learning. So upskilling, that means those who are already registered practitioners, registered nurses with the Nursing Council of India, those who have already trained as a MSc nursing, graduate, postgraduate nursing, graduate nursing, to them we have developed the module, 6 months module for the specific AYUSH training. And it is in general nursing, like Ayurveda has a Panchakarma for the nursing as an assistant, or the diet, or the gynecology, or Kshara Sutra. So very specific procedures, therapies, the nursing they should know the Ayurveda specific patient care and the therapy, so that knowledge of the herbs and the manufacturing, like how we prepare the decoction, the kitchen pharmacy. So these modules have been added as an additional training to already registered nurses. So that is a postgraduate diploma and certificate in nursing that has been approved by the Nursing Council of India. So that's the value addition. That is a general nursing. And now, considering the demand, as you mentioned about the AYUSH nursing for the cancer management, like oncology or psychiatry, or specialized branch for the nursing in the tertiary care or palliative care or emergency care. So those modules also have been prepared for the specialized nurses, like MSc nursing in psychiatry, MSc nursing in diabetic food management. So for that, AYUSH module is being developed. And for that, we have, under the skill ministry, we have developed skill qualification for that, which is registered and most approved standardized module. Thank you.
I just would like to add one important comment from Professora Nina Silva, that represents the MIU in Federal University of Rio de Janeiro, that her group are preparing also the work about the medicinal plants in Brazil that grow. I forgot to mention, but it's very important.
Yeah, very important. Great. definitely we would like to also have added to that. Thank you.
Thank you, Professora Nina. Fátima, por favor.
And congratulations, Dr. Hudar and Dr. Sukunar. My question is, consider that cancer in child is not common. Okay. Ayurveda has many considerations about life cycles. And sometimes, many times, relationship between work exposure or father and mother exposure has great influence in cancer in child, for example. My question is, do you notice different developments or treatment in this type of cause that is so different about you plant exposure in mother and father, and particularly the development in children? Sorry, it's not good English.
So if I correctly understood the question, it says that if from the mother and father, the son or the child can get the cancer, right? This is the question.
Exposure, particular exposure in pesticide, something like this. When you have exposure in father and mother, and so is it possible to develop?
I don't think so that is there. Yes, lifestyle in Ayurveda, it has been told, or we can see also in many patients when we have an experience that not proper lifestyle is one of the reasons for cancer. Usually, yes, if you don't have a proper daily regime or a lifestyle, it may affect your systems and it may cause cancer. So I don't think so that from any other, because we can also see that many chemicals have been used all over. There is pollution, but also whatever the food we eat or we are eating, we don't know it is totally organic or not. And chemicals are also one of the cause of cancer nowadays. So I think this is definitely, yes, this type of things are causing, they are cancerogenic or they are causing cancers. They are the causative factors for cancers. But I don't think so by any mother or father who is having cancer, they can expose to the child.
And the question is if there is a different treatment of the children that have the cause.
No.
Dr. Berra, por favor.
Congratulations, Dr. Rue, for organizing this event. Thank you, Dr. Sardesmuk. Also, thanks, Dr. Hudar. I have one question for Dr. Hudar and other for Dr. Sardesmuk. First, what were the reactions by modern doctors about the integrative treatment with Ayurveda? That's for Dr. Sardesmuk. And to Dr. Hudar, you had mentioned 7 different strategies for the management of cancer. If there are any publication or any place where to look about that different kind of strategies.
Thank you, sir. I'll just give my answer of the question of how was the reaction of the modern doctors. I'll be frank with you. When we started this project in 1994-96, there were not many modern doctors who would believe in Ayurveda. That was the main thing which we faced. It was one of the toughest things that we faced. But there were many also nice radiologists and oncologists who believed in alternative medicine. And they thought that Ayurveda, a traditional science which has been there for so many years, can help to reduce many side effects. So that was the aim which they came to us. And that was the reaction was first time was not so much helping. They were not supportive. But as we got the results over the time, we could see many patients, we could treat it together and we could see them the results. That time, more and more oncologists and oncosurgeons and radiologists started to joining with us. So I think so this is how it was a process. It was not easy, definitely not. But yes, now I think so. In this, at this point of time, many oncologists are open. They have opened the doors for traditional medicine to come on the board and to be into the integrative medicine together in the frame of the integrative medicine. So I think now it is more easy for us.
Yes, thank you, Doctor.
Doutora Paula would like that.
I think he's here.
Doctor, could I ask a question to Dr. Yes.
Yeah, pardon. Can you please repeat what you were asking?
Yes. In your presentation, you had mentioned in some diapos about 7 different strategies to different kind of patients. And I ask you if there is a publication about that, or there is one standard operative procedures at the All India Institute of Ayurveda published, any place where we could look about that different strategies, please.
Cases, about the cases which I mentioned, you are telling about.
Yes.
Yeah, actually, we are under publication of a single case reports, not exactly the whole data of this one. We had 2 to 3 very significant result. What we got, such cases are ready to publish actually. And just now it's not already published. They are on the way to publications, and this is just which I have shown is the data which we saw patients here, and we are regularly seeing those which are highlighted. We have statistics of that, but not exactly it is published as such.
Thank you. Hope to be that you will publish this data very soon. It will be very
sure. We are eagerly looking for that. In a good
Yes.
platform we are looking for, because we had very good results in a few cases which are really with evidences, with MRI reports and everything we have. That's why we are looking for a good platform to publish.
Excellent. Yeah. Thank you, Doctor. Congratulations for your work, also for the satisfaction.
We have another question from Dr. Paula that have to leave. I will do first in English, then I can translate to Portuguese. Dr. Paula from the Ayurvedic Committee. My question is that we need to look the training and specialization into our health professionals in an integrated way between the AYUSH Ministry, our India Institute of Ayurveda, and our universities to promote in the Ayurveda in the practice in the health system. Maybe this is the first step that we need to organize. As Dr. Tanuja mentioned, now the question is how Dr. Tanuja looked at that proposal, and in general, how to promote the training.
A doutora Tanuja escreveu aqui que ela teve que sair para outro compromisso.
Sorry, okay. But if Dr. Tanuja, did you hear the question?
I just thought I was about to leave, but it is for the training program you are mentioning.
Yes.
Yeah. So we can develop. It is a hybrid mode, or the training program. There is a set standard, that is a national occupational standard. That is, there is a rank. The module are developed with a very, very specific learning objective and learning outcome. And what do we really want? Why the training program, out of training program, what skills needs to be imbibed, so we can develop that. So we can customize as per the need from your need of this specific group. We can develop the program, and that the certification, the module imparting, that is a training operational part, and the evaluation part and certification part. The 1, 2, 3, 4 steps we can develop. And we have 12 training programs which are already registered, certified, and standardized. So we can develop this international way training program, and we can standardize that as well. So one group is trained, but the second and the third group will also get the same training and the basic, and then it would we will have the stage 2, that is advanced, and then the advanced. So we can develop a standardized module, and we have the expertise in developing that, because we have the AYUSH subsector skill council. So any type of a training program can be developed under this, can be registered as well.
Thank you very much, Dr. Nuz. Then we can discuss later the details about the program.
And thank you very much for all enthusiasm. And I really congratulate the organizer, Ricardo, George Bera, CABSIN, and I also congratulate Dr. Sukumar Sardeshmukh, Dr. Huddar, and everyone who had joined. And we look forward, and you are most welcome for meaningful collaboration to take the activities ahead. What is the next? Maybe next can be the training program. So you are most welcome. You please give us your query, and we'll come out with the, we'll reach you mutually. We can develop the training module for that, which includes theory, practical, demonstration, and clinical as well. Thank you.
Perfect. Thank you very much. I think to conclude, we are on time. Perhaps last question we could open. Now, if someone have the last question, then you can conclude in a good way. And I can do a quick resume of 5 points that we're discussing.
I think Carlos José from Inca was with the hand.
Carlos José, please.
Yeah. Thank you, Caio. Thank you, Caio. I just want to make a comment. As I am a medical oncologist, and I did my training in Ayurveda with Dr. Ruge in Yoga Brahmavidyalaya. And I think that this proximity that we are building right now with institutions, with the non-governmental like CABSIN, and governmental like INCA and Yoga Brahmavidyalaya, for example, here in Brazil, and also the institution abroad in India, it's an opportunity to start to talk about Ayurveda within the program of new oncologists, maybe trying to expose them to all this knowledge will be an opportunity to get this new oncologists, traditional oncologists, learning about the opportunity of to learn with this traditional knowledge of Ayurveda. So thank you for this opportunity. For me, it's like a dream as an oncologist is to see in my institution, traditional institution, we are now talking about Ayurveda.
I think your last sentence it's represents the entire event, Carlos. Your dream, it's our dream to implement in a evidence-based and the good training the Ayurveda in Brazil as other integrative oncology approaches, but now we are in the moment to promote with a high standard connection with the Minister AYUSH. I think it's a good opportunity. If some would like to give your last words.
No, I think I'm thankful to the, especially Dr. Ruge, Dr. Ricardo for inviting me and giving me a platform to share some of the research work which we have done. Thank you again, Dr. Tanuja Nesari ma'am, for her valuable support as always. And I'm happy to be in all stalwarts and to exchange some of the research work what we have done in cancer. And I think Ayurveda really plays a very important role in integrative oncology, and with evidence and research based, definitely. And also standardization of medicines is very important in such cases. So I think let us come together on one platform and strive for the same aim that let's bring Ayurveda in one of the frontiers for getting the treatment for oncology. Thank you very much, everyone. Thanks a lot.
Dr. Hudar would like to say the last words, please. We can hear you. It's mute.
Yeah, it's nice to see the effort for the integration, and we are also on the same path within the integrations inside India with allopathy and Ayurveda. The similar things, what possible best possible ways suggested by our director, Professor Tanuja Nesari Madam also, those at that level we can collaborate and start. So the hurdles which Dr. Sukumar has also told, nowadays these things are getting resolved slowly, because we are also aware about safety and efficacy of these drugs which we are using, and we are aware, and we are patient concerned as others can, and they are understanding our languages, and with mutual understanding better definitely we can go. The resistance is because they don't understand the things what we are doing. That's why the resistance is there. Once they understand mutually, definitely the way is open to everyone, and we can do great things, and we have a good platforms also. So I think we can do well. So all the best to everyone. Thank you.
Thank you very much, Dr. Hudar. Now, to conclude, I'd like to mention that cooperation started now with the integrative oncology, but to invite everybody to our next webinar in connect of that cooperation, that will be about pediatric neurology in the field of cerebral palsy, paralysia cerebral. We already connected the hospital, reference hospital in Brazil, that it's Hospital Cruz Verde, connected with Federal University of São Paulo to be part, and the Society of Pediatrics in the neurology also. We would like to mention that the step of implement the natural products from Ayurveda, we also want to bring this discussion to our regulatory agency, Anvisa, that we started to talk about this, how to promote the standard access medication, access to medication in public health, and the long COVID project connected with the Federal University of São Paulo and Federal University of Rio de Janeiro, and other universities can join us. We believe that training and research will be very important to promote all that field in the next future. Then, in name of the CABSIN, I'd like to thank everybody, all the audience. We want to translate the webinar to promote in Spanish and in Portuguese. The Jorge Berra can help us to make the subtitles. We can organize this. And we would like to thank also to the TCIM American Network that we belong, that engage 17 countries in the America to be part of that movement that started in Brazil and Argentina. Thank you very much.